So as I mentioned, this is a very personal issue for me because I started my career as a physician dedicated to cancer treatments, wanting to make a difference in the world of cancer and helping patients with cancer. I've always been fascinated by this world because it has such an impact on people and their families and their communities. How many people here have a loved one, someone you cared about who has been affected by cancer? Let's show of hands. That's literally just about everybody, and that doesn't surprise me. But I'm here standing before you as now a person in a policy position because through my career as a clinician, while I was able to help many people with treatment of cancer and other conditions, there are so many I couldn't help, and so many of my patients who were suffering preventable suffering and dying preventable death. And then over time, this field grew, and I was delighted to meet world-class researchers like Dr. Couzens, who shared so much cutting-edge information. So through the work of Graham and others, we now know that more than 60% of all new cancers in the U.S. can be prevented or detected early through lifestyle changes and or screening. Dr. Couzens noted how many deaths from cancer could be prevented if we paid more attention to better nutrition and physical activity. And of course, we've all been aware of the link with tobacco and cancer causation. And as this field has evolved, there's so many themes that can apply to so many of us. For example, it's always concerned me greatly, the leading cause of cancer death in our country for men and women is lung cancer, and that should be a almost completely preventable condition. That should be a rare condition in our society, not the #1 cause of cancer death in men and women. To do this work well, we need to go well beyond the doctor's office. I can say that as a physician who's cared for patients for over 30 years. We'd like to now say that health starts not just in a doctor's office, but also in a community where people live, labor, learn, play, and pray. I made that up, so I'll say it again. Health starts in the community where people live, labor, learn, play, and pray. So if you're serious about cancer prevention, you have to be multidisciplinary, you have to have a broad perspective, you have to work with people both in the clinical setting and then also in the broader community setting. You have to think about policy, befriend policy makers, which is a big reason for having the meeting today, and then congratulate each other for successes because this work is not easy to do. Now just last month, in January 2014, we celebrated the 50th anniversary of the landmark Surgeon General's report on smoking and health. We had a big celebration at the White House, which I was very honored to help open up. And it's stunning to see how this work has evolved, how with every report we find that tobacco affects just about every organ in the body. We also know that prevention works, and we know how to end the tobacco epidemic. The big challenge is, can we apply these proven practices in a way that saves more lives? Another tobacco project that our department's involved in, which we're very, very proud of, is an effort to try to make all the colleges and university campuses in the United States smoke-free and tobacco-free. There are about 5,000 of these sites. And about a year and a half ago, we started this tobacco-free college campus initiative. I've had the great honor now of traveling around the country and simply thanking leaders on campuses, whether they're faculty or more important students, administrators. And when they do that and make a stand, they also promote cancer prevention in a very concrete way. And next month, we're going to be unveiling new efforts to reduce disparities in colorectal cancer screening and also improve outreach to underserved populations, particularly in collaboration with community health centers. So as I close, these are just a couple ways that we can advance cancer prevention right now in 2014. I am just so thrilled that you all here enthusiastic about this issue because it is the future of public health. This is not easy work, but when you value prevention, which I know you all do, what you're saying is that you don't take a healthy day for granted. You understand that our good health is a precious and fragile gift, and the only way to protect that gift is through prevention. And to close, there's a wonderful saying from Dr. June Osborne, the former University of Michigan School of Public Health dean. She used to say, when prevention works, absolutely nothing happens and things are very boring, ... Let us all pray for a little boredom.